on your assessment. Okay. So first, of course, before anything else, before you're going to do the procedure to the patient, what are you going to check first? Aside from the vital signs. Before you go to your patient.
The armband.
Patient's
Care plan.
Care plan. Very good. Care plan. You have to understand what is the condition of your patient, what is the need of your patient, what is the previous activity of your patient, okay? So that you will also know your precautionary measures sa pasyente. If you go directly to your patient without knowing that your patient is, for example, have viral disease or bacterial diseases that can be crossed through contact. Tapos bigla niyo namin
Putangin na talaga oh.
Sorry.
Karidad.
Wala kasi akong copy eh. Yan yung kasi ng copy. Napasa sa Telegram. Okay? So you make sure to always check your patient's care plan or the doctor's order, the doctor's notes, or the previous endorsement. Okay? Next, before entering the patient's room, what are you going to do? Of course, the part of your rivers. Wash your hands. Gather the equipment. So, make sure that your equipment is complete before entering your patient's room. Right? So, you gather your equipment. Grab as much towel as you want. Blanket. We have your towels. Yan, towels. Your basins. Your urinal. Your
Tabo.
your tabo. Yes, dipper. Okay, your dipper or your later ka na. Okay? Your shampoo through. This is your shampoo through. This is your basins. At least you can have 3. Your, what is this one?
Bedpan.
Okay? So these are your equipment.
Ay, sorry. Ipit ka. Grabe naman to oh.
So put it aside. Make sure you complete or you gather your equipments at one table. Okay, it's complete, and then you have your working table or your bedside table. Alright? Now, after that, we already wash your hands. On your assessment, you have to wear na your PPE, ha? You can leave your gloves, you do it after. And then, after that, you gather the equipments. You already, what? After equipments, you have to announce. Okay. So, how are you going to announce? Sir, good afternoon. My name is Hannah. I will be your nurse for today from 7 morning until 7 p.m. And today we will be doing your activity of daily living. I'm going to I give you a bath. I'm going to clean you. Is that okay with you? Okay. And then after that, ask your patient, what's your name? What's your full name? What else?
The birthday.
Date of birth?
Age.
MRN number? And then?
The armband.
Armband. Okay? And then, after that, after checking everything, you have to, of course, check the vital signs. Okay? Don't forget your gloves. So, wala kasing gloves. Okay? After washing your hands, then when you are on the bedside of the patient, do your hand rub and then use your gloves. Okay? After using your gloves, of course, you have to ask the patient's name and then check the band of the patient, compare it with the name that he gave you. Sayang. Okay? Now, always, before touching your patient, make sure to wear your gloves. Okay? After that, you already already identify the patient. What's next? Take the vital signs. Privacy first. Privacy. Close the curtain. Close the door. Okay? And then, after that, safety. Make sure that the side rails is up. The wheels are locked. that the wheels are locked, you can start with your procedure. Okay. You can again check what's your equipment needed. What's the first thing you have to do in your ADL? Your
Urine
Elimination.
elimination.
So what do you need?
Urine. For the male, we have
Your
urine.
urinal.
And for the female is the bedpan.
You have your bed pad. Okay.
Do we need towels?
Get tissue.
Tissue.
Tissue. Of course, and then pang hand rub.
Ah, okay. Yan lang.
Hand rub and then a box of gloves. Okay. Now,
One tons of gloves.
sir, do you want to pee now? Yes. Put your patient into a
Fowler or semi.
position. First, we will do elimination pala sa kanya. Urine bag. Okay, this is, for example, patient with urine bag. Are you familiar with this?
Yes, ma'am.
This is what you call urine bag. Okay. There is a tube attached to this catheter. The catheter, wala kasi tayo dito, that is attached to the patient. Hindi ito ha, shot yung malaki. There is a catheter inserted to the patient and then it will drain directly to the urinal. Okay. Now, how are you going to drain, of course, your urine bag? You have to drain it sa urinal. So when you go to your patient, you have to make sure to open the urine bag. There are different ways in in draining the bag. There are different types of bags. Meron yung naka-roll siyang ganyan and then naka-clip. This one,
Ay, wow.
ito lang siya. You have to open, then close. Okay? And make sure the level of the urine bag is lower than your
Patient.
Lower than your urethra or your bladder. Okay? So, you drain it in your urine bag, in your urinal, and then
Naku, nabuhos na talaga, ma'am.
Ma'am, do we need to record first the urine sa ano
No.
niya?
That's what I am going to ask you. Where is the accurate measurement? Is it the urine bag or the urinal?
Urine bag.
Urine bag.
Urinal.
Yan, ma'am.
Urinal. Why? Kasi yun na yung last one.
Tsaka level lang siya, no? Kasi doon sana naka-iris. Ito ginairis.
The accurate reading is your urinal.
Ah, dito.
Ah, mayroon talaga siyang ano.
May sukatan yan.
May sukat.
May sukatan.
Kasi dun sa video,
Mali.
merong siyang
Triangular, ano
Opo,
yun
may
eh.
mga sukat sa
Actually, it can be, but it is not accurate. Why? Because it is a bag. Hindi siya stable.
I see.
So if you move the urine, alangan naman i-squeeze mo siya hanggang doon siya sa level na to get the accurate amount.
Okay.
Okay? So, you have to drain into your urinal, place it in a flat area, and check. Eye level. Dapat. Okay? Gets?
Yes.
So, where is the accurate measurement? The
Urinal.
Okay? After that, you can discard it in the bathroom. The toilet.
Ma'am, question.
Then, don't forget to record after the urine output.
Question.
Right? Yes.
Do we need to put, kailangan pa ba nating lagyan ng pads yung
Under
when emptying the urinary,
protection.
So,
You can put, pero it's not
was there's instances na magkaroon ng spillage.
Kasi yun din kami mag-ano sa baba.
Make sure that you really put it inside.
Oo.
Tulad kayo na,
May
Oo.
pipes na yan.
Pero private patient po talaga
Kung
na
private
pwede-
patient,
pwede.
pwede ka mag...
lagay, okay.
Bakit mo kailangan pagparang
If you're
For the urine
advised,
output, ito-document siya. Why? What is the normal urine output a patient should have? A normal person should have?
33 to
30.
30 ml per hour. Now, if a person will not void at least 30 ml per hour,
Need
what
to
is the
drain.
problem? Aside from drinking water, what's the problem?
Hydration.
Hydration. What else? There might be a problem in the urinary
Kidney failure, mga
Gusto
ganun.
malaman ko ba?
Okay?
So, kailangan
So, yun.
tumihi ng 30 per
So,
hour?
if you ask why is it important?
Hindi ako umiinom.
For us
Kasi isang
to
araw.
urine output, or if you go
Dehydrated
over
ka.
OGT, you will find out
Isang beses ka naman
orders
isang
like
araw eh.
measure intake and output. When you mean intake and output, meron yan sa care plan, yes. If you will discuss the care plan, you will see that. When you say intake and output, you will measure yung whatever the person's intake, and then what is the output. If the intake is higher, much higher than the output, there might be a problem for elimination of the patient. Okay? Gets?
Yes.
Okay? So that is the importance why we have to measure the urine output. Aside from measuring the urine output, what else are you going to check?
The
The
color.
color of
the
the
color,
urine.
the odor, the
Odor.
odor, or any discharges or blood.
Blood stain.
So you will see a lot of things in the urine that may lead to the problem
Signs.
of the patient.
Yeah.
Okay?
Findings.
Yes, ma'am. So, let's proceed. After that, we're going to do the urine elimination for
Patient with catheter.
Okay, female muna tayo.
Okay.
Tapos na yung catheter.
Catheter.
Yun na yung catheter, okay? Okay, by the way, just for additional information, there is retained catheter. This is what you call your retained catheter. It is stayed in your patient with the urine bag. And then, you can change the urine bag. As a caregiver, you can change the urine bag as per hospital protocol, as per hospital policy. Usually, a week. A week. Pero it still depends on the hospital policy. You can do it kasi na-detach yan. But, you cannot remove the
Catheter.
Okay?
Yan lang. Yan.
Ito lang. Yung bag lang. So, you can change the bag, but not the catheter. Catheter are procedures done by doctors, physicians, or trained nurses.
Okay.
Right?
So,
Ate, akala ko tayo maglalagan.
Yung urine bag lang, ha? So, pag sinabi na, baka sabihan kayo, please remove the catheter. Ah, procedure yun.
Yan,
Pati
ganun
yung
ba?
May
titi na
balon yun.
tanggal.
Okay, may balon yun. Naku, pag hinila nyo yun, sakit yun. It will cause another injury. And then, there's another type of catheter that is straight catheter. Straight catheter, once lang yan, just for the patient to urinate. In some special orders, maybe, hindi ko lang sure ha, ngayon, kasi kwan lang yun eh, papaihiin nyo lang. So, you will just put the catheter, let the patient pass urine, and then remove it. That is straight catheter. Wala siyang balloon. So, it's not retained. Okay?
Pero i-attach
You can
mo siya.
assist yata the elimination through the straight catheter. Right? Okay, let's proceed na. So, since we have female, so again, the procedure, you have to do your hand wash and then do your hand wash. Ma'am, I'm going to give you the bedpan for you to pass urine, also to pass stool if she wants. Okay? Would that be fine with you? Yes. Okay. So what are you going to do first? You have to lower the side rails. Naka-gloves ako ha. Lower the side rails on your working area. And then, fan fold. Blanket lang muna, ha? The blanket kasi masyado siyang makapal. Fan fold to the foot area. Now you can let your patient move to the side, or you can just let your patient lift the buttocks. So make sure na meron kang
Bed
bed
cover.
fan.
Bed
Bed protector.
protector.
Bed
Okay?
protector.
Ma'am, can you please lift your buttocks by pushing your heel onto the edge of the mattress? So, tell your patient to lift the buttocks. So, the area of
Iaangat niya
insertion
yung
dito.
Hindi yun naman.
Huwag ito ha. Masakit to. Okay? This part. Okay? Madam, at the count of 3, lift your buttocks and I will insert the bedpan. Okay? 1, 2, 3. Okay. So, hindi niya, syempre, manikin siya. Okay? So, lift the buttocks and then cover your patient Raise the head. Raise the head in the semi-fowlers.
Hindi na masaksak.
So may iwan yung top sheet.
Kasi makikita yung pikeke.
Yung ano lang. Blanket lang.
Not too much kwan ha. At least enough lang na. Why? Because if you keep the patient on flat position, the tendency is mag-spill yung urine. So make sure as if that she is assuming a sitting position yung sa ball. Okay? Same goes with male patient na mag-pass ng stool. If you're offering the bedpan,
Oo, stool tsaka
you
yun.
can
Pag-bedpan.
use the stool for male. For the stool, passing stool, you can use the
Bedpan.
bedpan for male. Okay? Let the patient assume as if a sitting position, and then cover your patient. Then lift the side rails. Ma'am, I will leave the tissue here beside you. If you want to wipe yourself, you can do it. And then I will leave the call bell. And then if you're done, just press the call bell. Or I will come back after 5 minutes to give you time. And then close the curtains, go out of the room, leave the patient for some time to pass out the stool and leave. Okay? After that, I will come back after 5 minutes, knock the door 3 times. Knock, knock, knock. Mom, are you done? Yes.
Ay, sorry.
Okay.
Ay, sorry.
So, again, you have
Lantok
to
talaga ako.
rub, hand rub, and then wear your gloves. Did you wipe yourself, Mom? Not yet. Okay, do you want to wipe yourself? I don't want. Okay, I will wipe you. So, you wipe the...
Tama,
Maarte ang pasyente. Ayaw niyang hawakan sarili niya. Okay. I will wipe the patient using a tissue. But you are not going to do the
Perineal care.
Okay, di ba? Sabi ko sa inyo kanina, case-to-case basis, you can do the perineal care if
Don't pay them if
okay, they are already soiled with stool or urine. Okay. Now, how are you going to remove? Of course, you have to fold. Ma'am, I am going to remove the bedpan.
So dyan na yung tatanggalin.
You cannot let
Top
your
sheet.
patient turn to side because the bedpan might spill. But you have to ask your patient, can you please lift your buttocks? Okay? Lift the buttocks. If you are alone, you can try to lift the buttocks and remove the bedpan from the side. Okay?
Bedpan alone, ma'am. Hindi yung
Oo.
kasama yung protector.
No.
Okay.
Okay? So, bedpan alone. But, if ang protector is soiled, of course, you have to
Remove.
Case-to-case basis.
Okay? Now, one way,
Kasi,
another way in putting the bedpan. You can let your patient
Kasi
turn
nakalagay
to
sa buta.
side.
Nakalagay sa buta. Kasama yung bed.
Yung urine ng galing sa babae, ma'am, paano, saan nililipat, ma'am, saan sa mga network, ma'am, na
You have to still transfer it to that. Ita-transfer mo siya through this area. Pero don't transfer it on the bedside. You go to the bathroom, transfer it, and then
Wala naman pag may shot na eh.
kung may coat na siya, you can just take note kung urine with pants stool. Urine with stool,
Pag
and then
iihi siya yan.
try to estimate.
Remove ko to.
Pwede rin sa lahat, ma'am.
Oh, pwede. Okay, another way is if your patient is able to turn side or there is no contraindication to turn your patient to side, you can let your patient turn to side. Okay? Hindi siya napo-fold. How are you properly going to turn to side? Lift the hand, side, ganun. Ito kasi hindi siya napo-fold.
Yun ang maganda mo.
diretso pala siya.
Mabigat siya. Okay. And then,
May pilay kasi.
ask your patient, kasi andito ako. But you are going to, you are supposed to turn them on the strongest or weak side?
Strongest na.
Strong side. Okay?
Para it can support the...
So they can support. So this is the strong side. For example, this is the strong side of the patient. Okay? So it should be flexed, nakaganyan siya. And then tell your patient to bend the knee on your side. Ma'am, can you please bend your knee?
Ayaw ko nga.
Okay?
Sabihin mo.
And at the count of 3, you can, and then put the arm here on the chest.
Ba't di magkapareho kami?
Okay?
Tumabi ka ka, sampalin ka niyan.
Diyan ka lang. Okay. And then, at the count of 3, turn to your side. Okay? 1, 2, 3.
Patay na.
And
Huli
then,
na yan.
you can put the bedpan.
Bedpan.
Remember, if you are using a metal bedpan, make sure that there is a covering. Okay? At the count of 3, you can lie flat, ma'am. You support the bedpan kasi it will be moved. So make sure it's
Tumilapon.
okay. 1, 2, 3. And then, hindi kasi siya tao. Okay.
So, can chika muna.
So, make sure that it is in the center. Okay, and then provide privacy.
Puro naman nakita mo. Ha?
And then-
Tahimik ka.
Lift again the head part.
Ano gagawin?
Yan mo na si Mr. Perez gumawa
Sitting
niya.
position.
Baka matayihan niya ma'am yung lab gown.
Yung gown.
Mm. Ah,
Okay.
pag-EBS siya,
Siyempre,
ingat mo
kailangan
muna.
tanggalin mo.
Oo.
Iyan na siya
Kapag tanggalin
Oo.
siya, ipa-follow
Ang
position
lab
siya.
gown naman kasi, ang
Hati yan sa
patient
likod.
gown kasi may hati yan sa
Sa
likod.
likod.
So,
Igaganon mo lang siya.
Ay, ubutas yan sa likod
Ah.
naman.
okay, so no worries. Hindi yan matataihan. Okay?
Kapaluin ni Bani pagka
leave your
mataihan yung
patient
damit.
5 minutes or until she calls. Alright? And then, come back up. And coming back again, before leaving,
Remove the
you have to remove your
Remove
gloves,
gloves.
do your hand rub, and then go out of the room. Okay? And then, come back, knock the door again, and then, same step a while ago in removing. Okay? Unfold, and then, let your patient lift the buttocks. If the patient is unable to lift, kailangan mo siyang i-lift. And then, slowly, remove the, okay, bedpan. Right? Now, after that, we are going to do the male naman. Okay? For the male,
Ay, pag-ibig.
sana all nagpapalito.
Oo nga, ba't yun hindi na lang ganyan? Ano?
Migil ka nga dyan, Sajek.
Nalamin niyo sa babae mo?
So, sino yung giramin mo? Sino yung giramin mo?
Kay mami.
Ayaw kay mami ko naman.
Okay. For the male urine elimination, same procedure when you go inside the room.
excuse si Kat, ipangiti niya ngayon.
Ano naisip mo? Naisip mo.
Pulang naman mo.
Okay, after that, after doing your hand rub and your your gloves,
Urine elimination for male na.
sir, you will going to pass out your urine. I will give you your urinal. Would that be fine with you? Okay. Do you want me to assist you or leave you? And then he said, okay, I will do it myself. Okay. Then, assuming I have my gloves, again, you have to
Unfold.
unfold lang to the area that is needed to be exposed. Sir, I'm going to put on the urinal.
Naku,
Put on the
nakita.
urinal. Sir, can you please hold on to the urinal?
Hawakan mo, sir.
Example, he will hold it like that.
Parang
Okay.
gusto ko maging pasyente.
And then, leave your patient.
Kami ang nahiya sa Jer.
3 to 5 minutes.
Okay. Sir, here is the tissue beside you. You can wipe yourself if you want after. And then I'll give you some time to urinate. Just just press on the call bell if you're done. Or I will come back after 5 minutes.
So we will leave him this way lang, ma'am.
Okay, this way lang.
Ah,
Kasi
hindi mo siya i-return.
baka makakupad siya. Alright? Now, kasi baka mabubuhos siya.
Ayun.
Okay? So, you're going to leave the patient. Again, after 5 minutes, you have to remove your gloves, then do your hand rub. Then come back after 5 minutes.
5 minutes.
Or when the patient calls. Sir, are you done? Yes, I'm done. Are you okay? Yes. Do you feel anything? Nothing. Okay. Did you wipe yourself?
No?
No? Can you wipe for me? Sabi niya, okay, I will wipe. Okay. So, again, put on your, do your hand rub. Put on your gloves.
Di mo pa tinanggal, ma'am. Ay.
Tanggal na niya kanina.
Oh.
Put on your gloves and then, sir, I'm going to remove your urinal.
Hindi pa nga natanggal,
I
sabi.
will wipe,
Yan, kapag sila.
wipe, and then
Okay, sabay.
discard. Oh, naka-nakakuha na ako ha, naka-gloves na ako.
Assuming lang.
Assuming naka-gloves na ako. Okay, and then, of course, you have to,
battery. Be.
ayan, dapat discard na yan. Cover the patient, and then, measure your urine again. Okay? Whenever you leave your patient, never leave your patient
Unattended.
unattended without your side
Side drill.
Right? So, yun lang. Urine elimination and stool elimination. Any
Bye.
question? So, after your urine elimination, dire-diretso na tayo to your
Shampoo.
shampooing. What are the things you need for your shampooing? Shampoo.
Shampoo.
Shampoo. Shampoo.
Pan.
Shampoo lang.
Pan with warm water. Tapos pan with water
Okay.
and
You need
soap.
your shampoo through. You need your
Face towel to
basic
cover your
water.
eyes.
Ay, sorry.
Okay.
Sorry,
You
sorry.
need one.
Isa lang ba yung... Ay, oo.
Oo.
Ay, oo, isa lang. Kasi shampooing pa lang naman.
Shampooing pa lang siya. Pag sa paglilinis mo.
Dalawang tower, isa sa...
Sa face towel, itong protector dito, dalawa.
Okay. One towel.
Bath towel.
Okay na. Okay na yan. Mainit talaga siya. Wala tayong magagawa.
Uy, hindi na yan masusunod.
Ay, kunin ko nga yung sa cellphone.
Towel.
Wala.
Powerful.
Nanantok na talaga ako, promise.
Bed
Bed
cover.
protector.
Bed protector. One small towel.
Okay, magbe-remove yan ng ano.
And then, you can have your things as one na ganito. Just make sure that you have it organized, please. It's organized. You can bring it with you or kung gusto nyo isa-isa yung dalawa. Okay?
Ulog.
As for me, I want it as one. Para hindi na ako palitan.
Ay. Kahit yung pang ano.
So again,
Toothbrush,
before
andyan
I
na.
start, you have to make sure you do your hand rub and I change my gloves.
Dugaan.
Sir, now I'm going to wash your hair, okay? Would that be fine with you? Okay. Is that okay? Okay. Then, lower the head.
Uy, nanantok na talaga ako. Tapi yung cellphone ko nagluluwag.
Ano, super pulat ka mo. Winner ka sa ano, bulak-bulay ng mata.
And then, remove.
Yun pala yun.
Ay, tatanggal pala.
Yes.
Bili ako ng higaan.
You can remove the headboard and then you can pull your things beside you. So dapat doon siya kasi right-handed ako. Dapat doon siya.
Ay, dito kasi eh.
The pillow.
Yan. So, you have to remove the pillow. Sir, I'm going to remove the pillow, okay? Okay. At the count of 3, make sure to support the neck of your patient.
Patient.
At the count of 3, lift your head and I'm going to remove the pillow. 1, 2, 3. Right? Then, put on the...
Nearest, ano, dyan
You
lang.
put a chair beside you. If you want, you can put a chair beside you so that you can put
Put the
on your
pelvis.
patient. Now, your patient is far. What are you going to do?
Pull.
Hold the patient.
So,
Always
remove
make
muna.
sure to ask your patient anything you do to him. Always tell him what you're going to do. And always ask the cooperation. Sir, I'm going to pull you near me. So please, can you push your feet onto your mattress at the count of 3. Said, okay? Okay, at the count of 3. 1, 2, 3 behind the shoulders. 1, 2, 3. Okay?
Binagsak
So,
yung ulo
the
eh.
patient is now
Tigas ang
already
ulo.
near you. You can now put your
Bed protector.
bed
Bed protector.
protector. Sir, I'm going to put the bed protector under your head, okay? At the count of 3. 1, 2, 3.
Remove muna yung pelo bago siya yung nearest. Kasi sa video ni sir,
Then, you can prepare your
inusog muna niya bago
shampoo.
ito na-remove eh.
Sir, I'm going to place the shampoo through behind your head, okay?
Good towel.
Okay, at the count of
Malaking
3.
towel yun.
1,
Yung ilagay na tayo sa
Two.
shampoo sa
3. Saktan siya. Okay, yan. So, make sure that the patient's head or neck is in the yung ganitong
Nasa-
edge. Okay, at the edge of the shampoo tube. And don't forget to place your
towel.
towel on the chest. I'm going to put the
O, so lagyan siya ng towel sa chest.
towel on your chest. Sir, okay?
Ay, sir, hindi nilagyan.
So, you're going to put the towel on the chest and also put a
Wala. Sa tabi lang.
small face
Face
towel
towel.
on the
Eyes. Eyes diretso
eyes.
yun eh.
Make sure that you don't touch the edge of the towels on the skin of the patient. Why?
Because it can cause irritation, redness.
Diba? Lagi akong wine ng wine. Most students say, si Ma'am Hana mahilig sa wine. I want you to understand the rationale behind things so that you will understand also why we have to do
Avoid
the
these
properly,
things,
to
yes.
avoid things that will create injury or harm to your patient. Ah, pakuha ako ng
Why not?
Why? Basket.
Ay, nilagay na ang candy.
Yan.
Hindi ako nakatikim ng ice candy. Meron pa ba? Meron
Okay.
pa ba?
So, before you pull, sige, tapos. Okay. Make sure you have a hamper or basket
Linen basket.
behind you or near you. Yan. Okay. So, before you proceed with your procedure, make sure to check the water temperature. How are you going to check the temperature of the water?
Touch the water.
How are you going to touch?
The water
By your
should
elbow.
be...
Why elbow?
Kasi dirty yung hands.
Sensitive
Dirty
part.
and hands. And what else?
Ano daw tama?
Kasi?
Bakit elbow?
Gaano ka, ano, gaano
Kasi?
kainit daw yung tubig?
Ito yung
Simplest answer, ano?
ito yung pinakamahalo na skin para ano,
No?
Anipis na...
anipis, di ba?
Because malaki
Pinapahirapan
siya
yung
sa...
sarili nyo eh. Simply, you are wearing your gloves.
Ano ba tanong?
Ano, paano natin
Test na
Simply,
rin
you are
water.
wearing your gloves.
Ano ito test
You
yun?
Yung
cannot,
tubig.
you cannot touch the water kasi nga you have your dirty hands. Even if you have your bare hands, never
Yan
touch
ako
the
naman
water
sa
with your hands.
patient.
Why? Your hands is considered
Contaminated.
So, this is cleanest. Okay, so you can check it with your elbow if it's cold or not, if it's warm or hot. Masyado ninyong ano,
Complicated minded.
Pinapahirapan yung sarili nyo
Ano?
with the results.
From the beginning mo.
Before.
Ay,
You have to make sure, you have to check the temperature, everything before you proceed with the procedure. Okay? Now, after that one, di ba na-test nyo na yung tubig? If you have a thermometer, what is the normal?
Ayun nga, sabi ko.
Or what is the proper thermometer temperature of water?
37.7.
37.7
37.
degrees Celsius or
100 Fahrenheit.
100 Fahrenheit.
100 Fahrenheit.
now before, so you already position your patient, your water is already good.
37.1.
Okay, you can ask your patient, sir, I'm going to pour a little bit of water. If it's if the temperature is okay or no, just tell me. Okay? Ha?
Hindi ko yung tinignan.
Wala. Kaya nga tayo may towel na. Okay? So, you can pour a little bit of water and then the patient said, no, temperature is okay. So now, by the way, before you pour the water, what are you going to check?
Check the infestation, the hair, the scalp.
Okay, any infestation, any
Redness,
any breakdowns, any
tenderness,
dandruff,
yes.
whatever. Okay, make sure that
Baldness,
you check,
and
and then after
etc.
that you can
Hair
press the
loss.
water and then pour some water,
To check.
lather the water, and then you can put on the shampoo.
Shampoo.
Do not put the shampoo directly into the head of the patient. Kaya nagsha-shampoo kayo diretso ganun.
No.
Okay? You can put a little bit on your palm. You rub it on your palm, or you can put a little shampoo on the what's this?
Deeper.
Your tabo. Then put a little water. Then or put a little water first, then put shampoo, and then you can put in the head. Do not put directly. Okay? Now you have to massage from the frontal to the
Hospital.
okay? Massage, ladder, massage hanggang sa occipital area or the back or the
Back, neck.
Okay? Neck part. Okay. After that, you can wash. Wash until the soap or the shampoo is gone. Totally gone. Alright? And then, you can remove. Sir, at the count of 3, I will remove your shampoo through 1, 2, 3. Down here. You can use the towel
O, diba?
to
Nakalagay sa gilid
dry
yun kay
the-
sir.
Sir, I'm going to dry
Nahirapan pa
your
siyang
hair,
ilagay sa
okay?
ilalim kasi nakatupi pa.
Then you can remove the face towel. You can put it in your hamper. So I will use it. Okay?
Sinipon na.
So, you are going to pat dry the hair. If the patient is female, you can keep it
Ah.
like this until it is dry. Okay? So, after that, you can remove and put it in the garbage. Or throw it or put it aside. You
Designated.
can put it there, and then you can put back the pillow. Okay, sir, I'm going to put back your pillow at the count of 3. 1, 2, 3.
Hindi siya pwede mong lower agad.
Do you want blower? Do you want something? Okay, ask your patient before what's the shampoo she wants, or does she want conditioner, does she want blower, does she want her hair to be tied, or cream, whatsoever. Okay? Brazilian. Okay, after that, keratin. Your soiled linen, you're going to put into your hamper. Linen hamper. Now, what's your procedure next? You can keep the headboard dyan na. After na, so dire-diretso na yung procedure natin. Alright? So now you're done, you have to do your aftercare. Sige,
May bakit.
Ayan mo.
you can show the patient.
Hindi na po katawan na mahuhuliligwas.
Okay?
Nagmamadali kayo.
Sabi ko nga, kayo kasi masyado.
Kasi isa-isa tanggalin yung mga gamit na yan.
Now, after your hair, what is next? Your
Shaving for male.
shaving for male. Seems pa
Wala namang
tayo.
pag may bigote yung female, ganun din. Parang ponggo-ponggo yun.
On your assessment, you can grab as many towels as you want. Okay? Pero kung marami kayo, paunahan na. Paunahan na lang.
Alam mo na.
Now, what are the things you need?
Marami naman.
So, iniisa-isa ko sa inyo. I'm going to do it one by one para makita ninyo yung mga proper, yung mga equipments na kailangan. Okay? So, of course, we have your cream, shaving cream. You have your razor.
Electric.
And then, make sure you have your water as well.
Sabi ko, susulat ako. Nag-video kasi.
You have your towel and your small towel also. If your patient is diabetic, again, what are you going to use?
Don't use the shaver, yung electric shaver.
Electric shaver.
Electric shaver. Why are we going to do the shaving first before the oral care?
Because it
To
gets
avoid
the mustache can go
repetitive.
inside the mouth.
Okay, very
Sorry,
good. Now I'm going to change my water. Change it into warm water. I'm going to remove my gloves and change my gloves again. And then, sir, I'm going to shave you now, or you can do it by yourself. Said no. Okay. You don't want to do that. Masyadong tamad. So, you put your side rails in the side rails down. Okay. Remember, as what I've said, make sure that the level of your bed is in your waist
Comfortable.
level, or you're comfortable.
Working
Working
high.
high.
Working height, because
So you can
Or
avoid injury.
to initiate the good body
and
mechanics.
good
body
body
mechanics. Now,
mechanics.
in doing the shaving, you can put your patient into a semi-fowlers or a sitting position, or you can ask the patient to sit on the bedside, yung dito sa side of the bed.
Hindi, ayaw na niya mag-sit sa
Pero
side.
ayaw niya, kung kaya niya. But if he's lazy enough, you want to do it on bed. Now,
Semi-fowlers.
sir,
Oh,
I'm going to put the towel.
Towels.
Never forget to put the towel on the chest. And then,
Soak a small towel,
soak the small towel
the warm water,
for how many minutes?
3 to 5.
3 to 5 minutes. 30 seconds to 1 minute. 1 minute.
Di ba sabi niyo kanina?
30 seconds to 1 minute.
Oh.
On your manual is 2 to 3 minutes.
Ah.
But it's 30 seconds to 1 minute to 2 minutes.
30 dito na.
Just to soften the...
30 to 1 minute.
30 to 1 minute.
Oh.
Bagong kwan yan. Bagong ano to?
Bagong
Gawa niya sa
Gawa?
tumang ni brother.
Oh, brother ko. Maraming kwan. Char. Okay? Maraming ate. Kung haba-haba ng ginawa niya. Ang ginawa ko.
Sino brother niya?
Ha?
Ang sticky na bago.
Sino brother niya?
Kaya nga, masyadong mahaba sa Okay, after that, after soaking, you can ask your patient's preference. Sir, do you want some shaving cream, shaving gel, or soap, or what? You said nothing. Okay, nothing. Okay. You can shave from the chin. How are you going to shave from the chin?
From the farthest
From the farthest to the nearest. How are you going to? What are you going to tell your patient?
Ask the patient to
Tighten the cheeks.
fight the
Pop the cheek. Can you please pop your cheek? Or
Tightens
you
the
tighten the skin.
skin.
Okay, from up to lower. Or you can use
Kidney
the
basing.
kidney basing.
Yan o.
Bagsak na ako. Wala akong incomplete equipments. Okay. You can put the kidney basin here. With what, if you want with water, okay lang. But it will be difficult for you to
Para hawakan. Kasi gaganon mo yung ano
So
eh.
you have
Pala
to
mahaba din kamay.
Put
tighten
the
them.
kidney basin through the table.
Okay, so that is the purpose of your bedside table. Diyan siya kakain, diyan siya magtututbrush, diyan siya nakain. Okay? Then, pop up your cheek. 1. Or, then another 2. Okay? Now, after your cheek, your chin. Can you please tilt your head a little, or you do it yourself? Ikaw na. Okay? And then, after your chin, your
Neck.
neck. Can you please lift your head a little so I can shave your neck? Okay? From farthest to nearest. Okay. After that, after your neck, your
Lower
Upper
lip.
lip. Upper lip.
so ask your patient to
Bite the lip.
bite the lips or tighten the lip. Okay? So, close your lip na. Okay? Okay. After that, you can do the other side, the near you, the area near you, and then you can now use a clean towel, or you can use the towel on the you put on the chest.
For pat drying, okay lang.
Pat dry, and then you have to discard this to your hampers. Okay? We're done?
Yes.
Then do your aftercare. So after your shaving, what's next?
Oral.
Oral. For your oral care, again, you need your brush,
Toothpaste,
toothpaste,
After press.
glass,
gargle,
gargle,
tongue depressor, and then your
glass,
glass or cup.
cup,
You need your towel as well.
kidney basin and basin, kidney basin. Ah? Kailangan pa rin ng kidney basin, di ba?
And your kidney basin. Okay. Sir, now we're going to brush your teeth. Okay? Can you do it by yourself? I don't want. Ano talaga? Bakit ka? Okay. Now, always put the towel on the chest. Now, again, the principle in brushing the teeth is
Circle.
45 degrees.
Circular.
Up,
down,
down. Okay?
Side by side.
Ano ba?
Chin and chin.
So, assuming I already changed my gloves and do my hand rub, sir, we're going to brush your teeth. Can you? Can you please take a sip of water, or you can give a straw, sip a
Straw.
little sip of water, and then gargle.
Then speed.
Already gargle. You're going to now brush the teeth. Can you please open your mouth and show me your teeth? If the patient doesn't want, sige, ayaw mo. Use your
Tongue blade or tongue
Tamad ka
depressor.
ha? Okay.
Gag
Sige.
reflex.
From up,
Then down.
Down.
then down. Circular motion in 45 degrees. Then
Chin to chin.
Side.
cheek, the side, and then your tongue.
Tongue.
After that, you can offer again a sip of water, gargle, and then wipe again with your towel. Okay? Pabango ka na? And then again, discard, put into your hamper. Then do your aftercare. That is for your conscious
Patient.
Now, we're going to do your unconscious patient. For your unconscious patient, you have to make sure that you have also your towels,
Antok mo pinag-antok.
your
Bed protector.
bed protector. Okay. You can, if it's not contraindicated, you can wash the patient, you can brush the patient in this semi-collar position. But if not, for you to understand the difference,
Yung ano lang, 45 or...
you can put it in the semi-foulers, not in a high foulers. Semi lang kasi
30
hindi
degrees
siya-
lang siguro yun.
Hindi siya
Totally,
conscious.
oo, hindi siya totally naka-flat. Okay? Now, even if your patient is bedridden, even if he cannot talk, or even if he is in coma, always talk to your patient.
Ah,
Because still, the patient can hear you. As long as he's still alive, kahit bedridden yan, he still can hear you. Sir, I'm going to brush your teeth, okay? So, I will move your head. So, I assume I have already done gloving and hand rubbing. Sir, I will move your head. I will tilt your head towards me, or move your head towards me. Okay.
nabali na.
Ang tigas. Ang tigas na okay. Okay, at the side, and then
Put bed protector.
you can put a bed protector under the neck. Then you can put the towel as well. And then do your using your
Ang tawag nga pala niyo yun?
Ano ba yan?
Tips and
foam tip
Foam tip.
applicator or your foam tip brush.
foam tip.
You are
Yan yung tinatanong ko,
going
di ba?
to- Are
Foam
you
tip.
going to brush it with the brush? And the
Oh.
Are you going to use a toothpaste?
No.
You are going to put a mouthwash
With water.
with water. And then, do not, tapos,
Ay,
Meron din bang yung parang pressure na yung parang
spray. Oo, meron ganon. Pero kung hindi siya ganun ka-reach, ganito lang ang afford
Kasi
niya.
pag ginagawa yung gingivitis lang siya.
Meron din yung iba yung spray. Ganun. Spray, pala siya, spray siya. So, sa mga mayayaman na yun,
Ayun, electric na.
parang pan. But this one, for common people that they can afford is yung mga home tip lang. So you can dip into the mouthwash with water, then squeeze it on the side. Make sure to remove extra para hindi siya
Shock.
sulo. And then you can use again what I said is the
Suction machine.
suction tip,
Suction tip pala.
so that you can assist in
Suction
cleaning.
machine. Suction.
So, the same from the, so for example, I'm using the suction tip, pero you can also use your tongue depressor. Make sure to open the mouth properly, and then you can clean from up, down, side, side, open your mouth, then the
Tongue.
tongue. Okay? As long as you see still it's dirty, you can
Do it again.
do it again.
Mhm.
Until you can use as much applicator as you want until you feel that it's already clean. Okay? After that, you have to discard this. You cannot use this again. Okay? Now, you already cleaned the patient. You can and then discard into the hamper. You can remove, sir, I'm going to remove this. You smell good na. I want to kiss you. Okay, discard again into your
Garbage
Ano yun? Garbage
bin.
bin. Then, position your patient. Align your patient.
Naku, ayun naman. Nagka-stiffneck
Okay.
mo.
Sir, are you okay? Tapos bigla kang sinagot. Yes. Okay? That is your unconscious patient. Then, after your unconscious patient, you go to your patient with
Dentures.
Okay. Same goes with the patient with conscious patient. You have to position in the
Fowlers.
Fowler's position or sitting position. Now, how are you going to remove? Which one you going to
Down,
remove?
down, and up.
Up. And then soak into
Water.
water. Warm or cold?
Look
Tap
warm.
water.
Tap water. Okay? Make sure you don't put it in a hard or a warm water.
The
But
deform.
it might
It
be
alters.
deformed or it will become softened. And then, if you're going to clean the dentures,
Namumuno to naman ng dentures.
Mami.
Mami, pahiram mo muna yung dentures mo.
dati may denture kami. So, when you clean the dentures, same as like doing the brushing of the teeth.
Normal brush.
Circular up
And
down.
then, you can ask your patient, do you want me to put back your denture or can you please put it back? You said, I don't want to.
Patay tayo.
You put it back. What is the first denture you're going to
Up. Then down.
Then down. Okay? Done?
Yes, ma'am.
Good?
Good.
So what's next after your oral care is your?
Upper extremities.
So ito na. Ito na.
Hands, arms.
Eto na. Ito na.
Yung mahaba-haba.
Mga pa siya.
Eto na.
Ang bakit sa ospital mga pag nagano sila, tapos bakit dito,
No, kasi nagtupan pa lang tayo. Nagtidemo pa lang kayo.
Tinamban ba yung tinamban?
Okay. If you
Pinagbabawal
are
na technique siya.
to do it on an actual, you're going to, we're going to do it as fast as possible kasi to prevent chills kasi na-expose yung pasyente, lalamigin ang pasyente, especially that the environment of the hospital is cold. Kung ganito kainit ang environment ng hospital, okay na.
Kahit mga 4 hours.
Okay? So, what are we going to prepare now? We are going to prepare your bases.
Hindi ba ito nakaano? Tapos in-stop ko yung sa ano, dito sa
Dalawa lang.
For one ito, for soaking. Eh, yung mga sino mo?
Pwede matusok ka. Kayong dalawa. Ay, sabi ko sa pala yung
Pangkusyosa?
Timbang mo tsaka height.
Ano ako eh. Nakalimutan ko na.
Timbang na height siya na mabahala mag-solve nun.
Nakalimutan, hindi ko nga alam kung ano.
Hindi ka ba nagtitimbang?
Okay. I'm going to need my hot blanket.
No, 70 ako.
Kabigat yan.
I'm going to need my
Bed protector.
bed protector.
towel, 2 towels.
I will need much towel as I want. Again. Okay. Towels.
Ay, tulungan.
Okay. Now, sir, we're going to do your bathing now. Okay? Would that be fine with you? Say okay. So, lower the side rails. Assuming I'm done with my hand glove and my gloves.
Ma'am.
What I'm going to clean first is the
The face.
face. Okay. In cleaning the face, first is the
Forehead.
Eyes.
Eyes pala.
madali. Okay. Do not forget to always put the towel on the chest.
To keep touching.
Now, for the eyes, do not put
Soap.
water, soap.
Soap.
So I have two basins. So
One with
water with soap,
water
or
without.
plain water. So everything before you start the procedure, you have to change and check the temperature of your water. When are you going to change your water? If
It's
It's
dirty already.
dirty,
It's bubbly.
if it's bubbly,
It's
and the temperature. If it's cold.
temperature is
Cold.
okay. Now I'm going to wash the eyes of my patient. Okay. So from the inner canthus, close your eyes, sir.
Side tayo dyan.
Inner canthus.
Okay, inner canthus, outer.
Canthus.
Do not use this side kasi nagamit ko na siya sa other side. You can use the other side.
Okay.
Inner to
Outer.
outer. So, marumi pa rin. I will rinse my towel. I can turn it to the other side. And then, again, inner to outer. Laki ng muta mo. Okay. Inner to outer. Now, the eyes is already clean. I can proceed to the
Forehead.
forehead. Okay? You can do the water to wash. Of course, make sure that you squeeze the excess water. Okay? From the farther area, see
Stroke.
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 C-section.
And then
Cesarean
to the chin. Okay? And then we'll get some soap. Of course, do not forget to squeeze the water. You have to do it fast as much as possible. Okay? From the forehead, in the C motion, make sure that you do not touch the eyes kasi may soap ito. And then, to the chin. Then, rinse. Same direction. Now, you're done with the other side, the face, you can go to the neck.
Neck.
Okay? Same direction, same way you did with the face. And then, the other side. So, if you're done with the face, you can pat dry. Are you feeling okay? Oh, wala pa pala. Sa nose pa pala. Sorry, nagbutan ko. For the nose, the direction of your nose, you can clean from the
Upper.
ano to?
Nose bridge.
And then the
Nostrils.
nostrils. Yun.
Septum.
Septum. Okay. And then after that, do not touch the mouth kasi malinis na yung mouth. Okay? Now, when you're done with the face, you can already pat dry and then put into your hamper. Ano na? Carry pa?
Laban.
Laban?
Laban.
Para sa kinabukasan.
Para sa kinabukasan.
I was asking, ma'am. Una, ma'am, yung walang sabon, yung walang
Walang sabon.
Tapos, at
You can do with the soap, then rinse.
rinse.
Or if you want, or if you want, you can use direct na soap.
But then rinse.
Okay, but then as you like, kung paano yung gustong linisin yung pasyente. It's always how you want to clean your patient.
As long as fast as you can.
As long as fast as you can prevent change of the patient.
Patients,
Kasi nga,
okay.
tumay-tubig eh. Okay?
Yes,
Now, we're done with the face. What are we going to do next?
The neck. Neck.
Okay, arms na.
Neck.
Now,
Tapos na bang neck?
before you proceed to your arms, you have to dress and undress. Undress thing using the okay.
Oh, ito na yung malupit.
Change my gloves again.
Ito na yung malupit.
Okay, I will change my gloves. I will do my hand rub and change my gloves.
Andres na.
Nag-remove ka siya?
You have to make sure that unfold the blanket. You can use it again as long as, for example, this is new.
It's not yet
You
soiled.
can put it in the clean area or put it in a table beside you or a bed chair beside you. Okay lang. But better to start. Okay, put in a hamper. Okay. Now, sir, I'm going to untie the gown. No need to let your patient turn too much on the side. Sir, can you please turn your back a little? Okay, at the count of 3. 1, 2, 3,
sir,
untie it quickly.
pwede na
Or if not,
hugutin.
kasi usually,
Zipper.
hospital gowns, usually we don't tie the gowns. Why?
For
Kasi
easy.
tsaka, if this is kept on the
Rubbing at the
skin
back,
of the patient for long term, it can cause friction, it can cause irritation, and it will lead to your head sores. Okay? So usually, hindi na yan tinatay pag long-term patients. So you can easily remove. Do not remove first. You have to make sure to cover your patient. With your bath
Blanket.
Okay? Sir, can you please hold the bath blanket? Make sure to provide privacy. If your patient cannot hold the bath blanket, what are you going to do?
Insert in the
Insert
shoulder.
in the
Shoulder.
So since my patient is bedridden, I will insert it on the shoulder and slowly
Remove the top linen.
Nag-video naman kami. Magpa-assess na kami. Unfold. Check na lang naman yung video. Sige na.
Paunahin mo muna sila sa Jer. Sunod ka na. Matapos na to. Oh, paano ako nito? Magnganga ako.
Okay. Now, patient has gown pack.
Ay,
How are you going to remove the gown? Which one do you remove first? The strong or the weak side?
the strong side.
The strong side. So remove first the strong side. Okay, assume that the patient has the IV line here. I am going to remove it from the
Strong side.
side. Sir, I'm going to remove your gown, okay? Said okay. Expose only the area that you want to remove or expose.
Sino? Nandyan na? Wala. Wala.
Ma'am, paano kung sa bahay sila, ma'am? Meron din ang process na.
Standard.
Yun na nga. That's why I told you, when you go into practice, you cannot really say na they will do the standard. So what we are showing you is the standard for your assessment. If you're planning to get your test back, of course you have to do what is standard. Okay? So I'm going to remove. Okay, for example, the patient has IV line. Make sure to be careful with the IV side. Okay? Then put in the hamper. proceed with your ADL or your bile pattern. Okay? So I will change again my gloves. Sabi na niya.
Be careful mo lang, tapos gagawin mo sa mismo parang easy switch mo lang sa isa.
Okay? So, I will now do my bed bathing, starting with your upper extremities. Okay? Always do the farthest side. Why do we do the farthest side first?
Because you might be able to touch
Why do we do the farthest side first? Pwede ko naman gawin dito. Bakit dun pa sa malayo? Aside from that?
Too easy to wash.
Aside from that?
Kasi kung nandoon ba yung mga galit ko?
Aside from that?
Blood circulation.
Sirit? Sirit.
Sirit, madam.
Sirit, okay. The reason why we do the farthest side first, you can turn around. Okay lang naman mag-turn around as you like. But if you are working on one side, kumbaga dito lang ang gusto yung ang area nyo kung nasa, for example, nasa wall yan. So you have to do the farthest side to prevent
Andyan na?
infection of
Andyan na ba?
cross-contamination of the other area. For example, nasa wall yan, nakadikit yan sa wall. And then, you're going to clean this area first, before this area. And then, malinis na ito. Marumi pa ito. So, the tendency is,
Sabi ko nga eh,
cross-contamination,
parang
tutumihan na naman ito kasi you're touching the patient. Okay? To avoid cross-contamination. Okay? That's the reason why we do the farthest area first. Now, I'm going to do the arm, upper extremities first. I'm going to expose only the area that I will be cleaning. Bakit pa yung kamay mo? Okay, I will put on the bed protector. I always tell my students to communicate with your patient to gain cooperation. Sir, I'm going to put the bed protector under your arm. Okay, can you please lift your hand? While the patient is lifting the hand, you can assist him in lifting the hand. And then, place it like this. So, your water is already clean and changed. I'm going to, for example, I'm going to wash directly with soap. So, my patient is not diabetic, not coma, not hypertensive, not CVA. I will start from the where? Proximal,
Distal.
distal. Okay? Make sure to support the elbow, especially if the patient is weak. Make sure to support the elbow. Then, other side. Baba mo muna. Okay? Get some soap again. Squeeze and then you change it on the other side. Then, one stroke again. Use the other side. Another stroke. For some, they will change it like this. Pero I know it's difficult for you. And then, ganon. And then, ganon. As long as you don't use one side in different areas. So you have to change the sides. And then, you have to also clean, in particular, the armpit.
Ma'am, bakit one stroke?
One stroke, then the other side. Gets mo? For example,
Anong
Eh kasi kung ibabalik mo siyang gano'n,
Sabi pa rin. Cross-contamination.
Di ba kukungibag?
pwede mo di ba dito?
Pwede mo naman balikan.
Oo.
Basta one stroke.
Pero is one stroke.
Pero kung madumi siya talaga, isang direksyon na ganun mo, pwede naman yan eh.
Okay?
Galit ka ba?
Okay? After that, soap, and then rinse with
Lagyan mo ng 4.
Wheelchair? Trolley?
Okay.
Ito?
Ah, ilagay mo lang.
Ayun ang may isa pang buka.
Yung
Oh, yan,
wine.
nagaling mo na yan.
Yung wine.
Yan, pwede yan.
Yan, pwede yan.
For ano
Alam mo,
ba
Arnold
gagawin
po.
niyo?
Pwede yan, makaya
Pwede
yan.
yan, okay yan.
Equipment lang naman ng ano, magaan
Oo,
lang yan.
magaan lang yun. Go, Sager.
Okay? Now,
Hindi ka nakapaan.
Pag naka-5 ka,
After that one,
Starbucks kita.
you can pat dry the arm. Pat dry even the armpit. Why are we not doing like this? Bakit pat dry? I always tell you pat dry.
Irritation.
Hindi magkaroon ng friction sa skin.
Low naman.
Alam na. So, if you passes na kayo. So if you do like this, like the usual thing we do at home, aminin, diba?
Yes, ma'am.
We are creating irritation or
Mabula siya.
rashes. So, we do not rub. We pat dry. Okay? Now, after that, you can soak the hand with water and do the other area. Okay? So, while doing the other area, nakasoak siya. Soak with soap and water. Then, after that, you're done with the other area, you can now clean.
Ibabad yung
Kamay
Babad yung
lang.
kamay niya.
Fingers lang. Yung daliri lang. Okay? Then, you can do the cleaning from the digits, okay, of the fingers, the palms, as long as you clean it. If you want to trim, you can trim as you like. And then, you can remove the soap with water, and then you can pat dry. Or after rinsing, you can pat dry. And you can do your ROM, range of motion. Flexion, extension, adduction, abduction. Yan. Okay? After that, remove and then discard. Okay? Now you're done with your arms, your upper extremities. We will do your chest. So in doing your chest, again, after you do the procedure, you can change your gloves. Okay. Now I'm going to go with the chest. How are you going to do it? Again, make sure that you have another towel. Change another towel. Kailangan mo mag-change ng towel. Malaki masyado. Dapat yung lang, yung smaller lang. Half lang. Okay. Okay. Sir, can you please hold? If you cannot hold, insert.
Under the shirt.
And then, fan fold up to the
Hips.
hips or the waist level. Daming arte mo. Okay. Now, assuming I changed my water kasi cold na siya, I will now wash with the soap. Okay? In washing or in wiping your chest, you have to do it in one stroke. So, dapat under the towel. Okay, for your demo purpose, I will remove the towel so that you will see it. Okay, one direction, up to down to the waist level. Then flip, up, down. Then you can change. Dapat under the towel siya, ha? Kasi some students may think na, ay, tinanggal na ni Ma'am ang kwan. So I just remove it for you to see the stroke. Kung paano. Okay? Up to down.
And then other side.
Other side, up to down. I will change again. Okay? Then change again. Then sa side. Up, down, then up, down. Then rinse. The same procedure. Okay? It should be done under the
Towel.
Pag babae, ma'am, sa ilalim ng baby.
Ay,
Pwede rin. You can, basta up,
Pwede
down,
sasampay mo pa dito.
basta as long as nire-direction
Dito ka
is
magsimula sa
Kasi, di ba may mga malalaki?
Basta yung
Hindi
down,
kakain mo
tapos
yung
other
dede,
side.
ipa, ano
Ipa pwede
ganyan
naman
mo.
i-lift then equal mo sa baba.
Hindi ka ganyan,
Okay?
tapos pag dito,
Kaya.
ganyan mo na lang.
Sinampay.
Basta as long as the
Direction.
direction is up,
Up to down.
Okay?
Ano lang,
One stroke
One
lang and
stroke.
then you
Sa
change
pagano
to
ako.
other
Wow.
side. And then cover your patient and ask the patient to hold or put it in the other
Under
pocket in the
shoulder.
shoulder. Then discard.
Ang dami ng tawin.
Daming towel, no?
Isa pa
Okay.
siya. Ang daming papagawin.
Now we're done with the chest. Tapos na tayo sa chest. Where are we going?
Lower
Foot.
extremity.
Foot na tayo. Okay. So I will change again my gloves. I will change my water. Then I will expose only the area that is,
Needed to be
Needed.
washed. Washed.
we will do the bed making next week. Okay. So bed making and ano pa? Bed making.
Bukas assessment mo sa Saturday.
Wait, bakit late kayo?
Wait po kami.
Kasi
Marami
marami.
kami,
Kasi
ma'am.
marami.
Okay.
Kaya nga po yung iba namin nagkakabol sila.
Lower extremities na tayo. Do the first one, ha? But for me, I will do this area. Okay, again, you have to lift. Sir, can you please lift your leg? Okay, I don't like. Bahala ka. Only expose the area that is needed to be washed or cleaned. Okay? So, this is the exposed area. Again, I have to wash with soap. From, assuming my patient is diabetic patient, where, ano ba yung paa mo? Okay. Assuming my patient is diabetic patient, where I will start?
From the
Distal to proximal. Distal to proximal. Sa leg area lang, ha? Do not include up to the groin. Kasi yung groin natin is for the perineal. Okay? One stroke. So, I know this position is very difficult for a patient. You can either help the patient in lifting, or you can just tell your patient to flex or bend the knees. Then you can 1, 2, okay, and then change again. Then 1, then 2, and then rinse. Okay, same procedure. Then I'm going to soak the feet of the patient while I do the other side. Okay?
Napasay.
Huh? Okay. After that, we're going to wash the toes in between the toes. Okay? Clean properly. And then, after that, you can rinse with water or wipe it with water. Okay? You can wipe with water to rinse, and then you can now remove, and then you pat dry. Pat dry again. And do your
Range of motion.
range of motion.
Flexion, extension.
So, after that, cover and then discard. Okay? Tapos na?
Yes, ma'am.
So, now we're done with our lower extremities.
4.
4 o'clock. Until what time there?
4.
Sige lang na.
Sige lang, ma'am.
Sige lang, ma'am.
Perennial na tayo, di ba?
Sa amin, ma'am.
Hmm? Perennial na. Okay, perennial na. Okay?
Gusto pantayin yung prayer.
Gusto talaga yung perennial. So, what do I need for my perennial? Same. You have your towel. And your water. You have, may pa naman sa ilalim. Okay? Now I'm going to do the perennial care. Okay? For my perennial care, lalaki. Okay. For the male patient, for the male patient, you can ask your patient to either nakaganyan siya, then you put another towel on top of the patient, or you can still do the, sir, can you please lift your leg?
Legs.
Or ano to?
Bend.
Bend your knees and your other knees.
Yan, nasigit na talaga.
Huwag kang gumalaw kasi.
Perfect.
Expose only the area that you want to expose. Gitna. Okay? And then you can do your cleaning. You can do your cleaning from here. Okay? You can do it from here. As long as it is covered. Okay?
Takpan din siya.
Oh, takpan din siya. Privacy.
Ay, namboso talaga siya.
So, para okay, for your ano to? For demo purposes.
Break the glass in case of emergency.
For demo purposes. Okay? What is the stroke again? We will start from the ano to? Mons pubis. Mons pubis. And then wash. Change. You get, and then from the
Tip of the head.
tip of the head, circular motion until the
Sharp.
shaft. To the dito muna.
The head.
The cup lang. And then change. Then one third. Then up and down. Up and down. Change again. Gustong gusto. Kinikilig ah. Then
Super tutok talaga.
support up and down until the yung dito yung ano to in between the balls and the shaft. Okay, make sure it is cleaned properly, and then you change again
Intersection of the
from your balls down to the sa ilalim ng balls, other side down to the balls again, the other side, then to the under the balls, then again soap, and then you clean from under the balls to the perineum to anus. Then you rinse. Rinse with water. Okay? So we're done with the male. Doon na tayo sa female.
malambot.
Hindi, hindi nakatiis. Hindi siya nakatiis.
Oh, dyan na muna. Hawakan mo.
Hawakan mo. Ako meron na akong ganito. Ikaw, wala, oh.
Okay.
Diabetic kasi siya, kaya ganun.
Kaya malambot. Okay? Ganun pa rin yung position. You have to lift the leg, bend the knees. Okay? And then, same as a while ago. For your demo procedure, ganito lang muna. Okay? Again, soap with water. Huwag mong isipin. Mons pubis again. And then soak with water.
Groins part is the
Groins
Groins.
right.
Left and right.
Groins.
Left and right.
And then, again, your labia, majora, labia,
minora.
from which direction? Down or up?
Up, 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 down.
And then, rinse again. Change with, ano to? The soap and water. And then your labia, minora.
Minora.
Yung labia. Okay? Yung other side, then the other side. If you cannot see the labia minora, you can
Open.
okay? Open. As you like, kung paano. So, syempre, kasi left-handed ako. So, I can do it from this side and then iwa-wipe kong ganun. Okay? So, after that, I will do the clitoris to the perineum and then change
Clitoris to
then
anus.
open clitoris to
Anus.
anus. Then rinse and then pat dry. Okay? After that, I will,
Hindi na sinishave mo.
gusto mong i-shave, you can.
Oh, ask lang the patient.
Laser.
Uy, may laser na. Ngayon wala na siya.
pasyente ba bedridden daw ang patient.
Pwede naman
You
tayo.
can shave
mag-ask.
it.
Okay. Now, you're done with your perineal. You are going to do your back.
Back.
So I'm going to change again my gloves. I need to change my towels. I need to have an extra bed protector. Okay. Then I will now Sir, can you please turn to your side? If your patient cannot turn to your side, you have to turn your patient to the side. Again, how are you going to position?
Lateral position.
Lateral, how to do the lateral position? Flex the arm like this. Put the other arm on the
Chest.
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 Ang tigas.
Chest?
Dito.
Dito.
Chest.
Dito.
Abdomen.
Abdomen.
Yeah, abdomen. And then, you have to bend the knee. Sir, can you please bend your knee? Okay? At the count of 3, turn to your right side. 1, 2, 3.
Hala, nahulog.
Okay? Make sure to cover the patient for privacy. Sa side siya masyado. Okay. 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 Now, the reason why I said we have to have another extra bed protector in case that the protector is not reaching this side sa back, because we're doing the back, you can put
One more.
one more bed protector. So, you have to, again, wash the back with soap. Ay,
Yung patagilid.
mahirap sa mali. Usually, pag ako, gusto ko ang pasyente baba, tae. Pero, next time, your patient could be your classmates. Sa demo. Pag sa assessment, kapag ako. Kapag ako. Paano yung perineal, ma'am? Okay, hahawakan lang na yun. Okay. Okay? Now, I'm going to do the...
Hahawakan lang doon.
Yung
Okay?
manikin.
Pwede rin, gusto mo yung actual?
Ay, kunwari ito,
Sanay na yan
ito
si
ma'am,
Mami.
bidikit ko lang sa
Oo,
kaganya.
yan. Hawakan lang yung
Oh,
ganyan.
Catherine.
Okay? Now, the back from
Kala ko yung PKB talaga
up
hawakan
to
mismo.
dito na part.
Hanggang ano lang siya.
Oh, hanggang dyan na
Coccyx.
coccyx na dito lang
Coccyx.
siya.
Coccyx lang.
Coccyx. And then, other side, up. Dyan. And then I will change my soap. Then up. Then down. Okay? And then I will rinse. And then I will pat dry. Now, I will go to the buttocks area. So since this is not cleaned a while ago, I can clean. And then this side, I will change again. Clean. Then change. And then clean. Then the other side. Change. And if there is water and you feel that it is not yet cleaned after nung perineal care, you can clean it from the inner to outer. Then you can rinse and you can now pat dry. Okay? Then discard. Okay? Sir, at the count of 3, you can...
Ma'am, hindi na gagawin.
Ay, ito pala. Sorry. Thank you for reminding. Okay. What are you going to do is your... What? Back?
Back tapping.
Diba? Back tapping as what I have told you a while ago with the direction of your lungs. So you can do, then side again, then or okay, or you can do the effleurage.
Effleurage.
Parang it's just for relaxation. Kinukan mo lang. Minamassage, hinahaplos mo lang yung likod mo. Okay? So that is your back rubbing. Again, the purpose of your back rubbing or your back tapping.
For the secretion. For the... Ano ba yan? Blood circulation.
Okay. And
Relaxation.
Relaxation. Okay. Okay. To facilitate expulsion, to soften,
The secretion.
secretion, for relaxation and circulation. Okay? Now you can turn your patient to flat on bed. Sir, you can now turn on your back or in your supine. 1, 2, 3.
Ma'am, before we start the bathing,
Mhm.
we open the towel and we will see it first. We put this on inspection first, the color, then
Yes,
the
you can do the inspection, everything. Oh, everything you do the procedure, you can check